بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك أنت العليم الحكيم. My topic today is about presenting 10 to 12 cases of spot diagnosis in pediatric age group. The first case, as we see here, it is a 3D images of the skull, and you see here there is a hole and in the parietal region and another hole in the right parietal region, and you see here in the coronal images CT scan, one hole it is closed and the other hole is barely opened, and this is called biparietal foramina, and this is a normal variant and should be not mistaken by pathology. Next case, as we see here, it is sagittal 3D images of the skull, and we see there is a fracture line involving the parietal region. And on the axial cut CT scan, there is a large epidural hematoma in the parietal region, and this is the fracture line, and that extra epidural hematoma surrounded by hypodense edema and causing compression and of the left lateral ventricle or crossing the midline and midline shift, and this should be evacuated urgently. Next case, we see here in this axial CT scan, in this axial MRI, T1 and T2 weighted images, slightly dilated lateral ventricles, left more than the right, and we see here there is bilateral band heterotopia surrounding the lateral ventricles, and this is more prominent on the left side than on the right side. There is also an incidental finding. This is cavum septum vergi with this patient. Next case, this is 1-year-old child has difficulty in breathing and upper respiratory tract infections. As we see here, the posterior nasal cavity is open, and here it is closed with bony component, and this is called choanal atresia or bony part, and there is some secretion and collection proximal to the atretic part. Next case, here sagittal MRI image of the patient. This is the spot diagnosis. There is a genesis of corpus callosum, and there is no corpus callosum seen in the midline image. And also we see another anomaly. There is bright spot, and this is ectopic bright spot of the posterior pituitary gland. It should be here, and it is an ectopic position. Next case. This is a 9 years old child with eye pain. As we see here, this is axial CT scan at the level of both orbits, and we see here there is a proptosis of the right eye, and there is edematous changes around the right eye. And here we see there is subperiosteal abscess and osteomyelitis of the lamina papyracea on this side, associated with orbital cellulitis. Next case, this child presented with this is 16-old girl with blindness, and we see here this is the bilateral persistent hyperplastic primary vitreous associated with microphthalmia. There is bilateral persistent hyperplastic primary vitreous with microphthalmia in this child. Here, the next case, we see with the next case, this child presented with delay, abnormal delay, seizures, and stiffness. And the child is girl, and it is 4 years old. We see here bilateral, almost symmetrical increased signal intensity in the both the frontal area in this T2 weighted images, and this is Alexander leukodystrophy. Next case, this is 11 years old child with double vision, and as we see here, there is large mass in the posterior fossa midline. This is T1, T2, and enhanced T1 images. And there is here cystic component of the mass, and there is hyperintense mural nodule. And that hyperintense mural nodule, it is enhancing, and it is highly suggestive of the juvenile pilocytic astrocytoma. Next case, 3 years old child with the status epilepticus. As after the status epilepticus, as we see here, diffuse hypodense area involving the temporal and frontal region associated with brain edema and effacement of the basal cistern. And you see the bright cerebellum, it is not affected. And this is diffuse hypoxic injury following status epilepticus. Next case. This is 7-month-old child with macrocephaly. As we see here, this is T2 weighted images, and we see bilateral subdural hematomas. But the hematomas are in different stages of bleeding and with membrane. This raising the possibility of child abuse. Next case, 4 years old child with a history of seizures and delay development were presented with vomiting. As we see here in this axial flare axial images, there is a large enhancing tumor mass in the region of the foramen minor, causing obstructive hydrocephalus in patient with tuberous sclerosis. And this is giant cell tumor, giant cell astrocytoma. And we see here abnormal signal intensity in the subcortical region. Here, their frontal region and the frontal region, and these are consistent with subcortical tubers in patients with tuberous sclerosis. Here, in the next case, we have 3 days old infant, 25 weeks. As we see here, cranial ultrasound with patient with intraventricular hemorrhage filling the left ventricle and the third ventricle, and also intraparenchymal hemorrhage on the right side. In this coronal ultrasound, coronal cranial ultrasound, consistent with grade 4 bleeding, intraventricular parenchymal hemorrhage, and hydrocephalus. Thank you very much for listening. Hoping to see you soon in another talk.